Hi everyone, in this video we're going to talk about the research evidence on water birth. Hi everyone, my name is Dr. Rebecca Decker. I'm a nurse with my PhD and the founder of Evidence-Based Birth. And today I want to talk with you about the evidence on water birth. If you're coming to the Evidence-Based Birth YouTube channel, you're probably interested in what the research evidence has to say about water birth. So today what I'm going to do is cover in detail what is water birth, what makes it different than water immersion during labor, what does the evidence say about health outcomes of water birth, what are the pros and cons or benefits and risks, what do professional guidelines state, and what is the bottom line? And if you decide water birth is something you want to pursue, what are some questions or ways you can advocate for yourself? Are you ready to get started? All right, let's go. So what is water birth and how is it different than water immersion in labor? So with water immersion in labor, you may get into a tub or a pool of warm water before the baby's born. So you're having your contractions, you're laboring in the tub. You may get into different positions on your knees, leaning over the edge of the tub. You may lounge in the tub. And the evidence is pretty clear that water immersion in labor is safe and beneficial. Where people start to disagree is about whether water birth is safe and beneficial. And so with a water birth, you actually give birth to the baby underwater and then you bring the baby gently to the surface and they take their first breath and they rest on you while kind of the rest of their body remains in the warm water to keep them warm. And whether or not the placenta is born in the water depends on your situation and your provider's preferences. But researchers use the term land birth, which I think is so funny because it reminds me of, something like pirates or something. But they'll say land birth when they talk about having a conventional birth on dry land. And they say water birth when they're referring to the baby being born in the water, then being brought to the surface. The word hydrotherapy can be used to talk about the therapeutic use of water at any point in labor. So that could be using a shower or a tub, or it could include water birth. So water birth has been around for a while. It was first reported in the year 1805 in a medical journal, and it started becoming more popular and getting more attention in the 1980s and 1990s. And as we will see, research began being published, and now we have a lot of research on water birth. In the early 2000s, the American Academy of Pediatrics released their first statement about water birth, in which they said, 1, there had been no research on water birth. 2, water birth was dangerous for newborns, and 3, there were no benefits for mothers. But the truth was, by this point, researchers from all around the world had already been studying water birth for several decades, and most of the research had found, and continues to find now, that with low-risk births, the benefits of water birth greatly outweigh the risks. So we have 5 different kinds of water birth research. We have randomized controlled trials where the researchers flip a coin and you are randomly assigned to either have a water birth or a land birth, and then they compare your outcomes. We have observational studies. These are when researchers follow people to see, do they have a land birth? Do they have a water birth? And they compare the outcomes, but they're not randomly assigning you to a specific group. We also have meta-analyses and systematic reviews. These are studies where researchers combine a lot of data from a lot of different studies to try and look for overarching trends. They're kind of combining all of the statistics together. Then we have qualitative research. This is where researchers are looking at patient interviews or written text to kind of look at rich, in-depth data to see what it feels like to have a water birth. And then finally, we have case studies, and each case study contains a report of a single rare health outcome. So I'm going to go over all of these, and if you want more details about each one of these categories, just go to evidencebasedbirth.com/waterbirth, where we have a lot more detail about each of these categories. So far, there have been 5 randomized controlled trials on water birth, and they have shown several benefits to water birth, which I'll read for you. Lower pain scores, less use of pain medication during labor, less use of artificial oxytocin, also known as Pitocin, shorter labors on average, a higher rate of having a normal vaginal birth, that means you give birth without the use of forceps, vacuum, or cesarean surgery, a higher rate of intact perineum, that means the tissue between the vagina and the rectum remains untorn and uncut, less use of episiotomy, which is a surgical cut with scissors to the perineum, and greater satisfaction with the birth. In Table 1 in our signature article on evidence-based birth, I give details about all of these studies, but right now I just want to kind of give you a brief description of 2 of these randomized controlled trials. The first was done in 2013. It was published by Gassimi et al. They randomly assigned 100 people to waterbirth and 100 to land birth, and this is the largest randomized controlled trial that's ever been done on waterbirth. In the end, 83 people stayed in the waterbirth group, 88 people stayed in the land birth group. It's not clear why people left the study. But they did find that the people who were randomly assigned to waterbirth, all of whom also labored in water, had a lower chance of needing a cesarean later in labor compared to the land birth group. So the cesarean rate in the waterbirth assigned group was 5% versus 16% in the group that was assigned to have a birth on land. Participants in the waterbirth group also reported less pain. There was less meconium, which is the baby's first stool, in the amniotic fluid with waterbirth. It was 2% versus 24%. And there were fewer low APGAR scores with waterbirth compared to land birth. And an APGAR score is a test of how well the baby is doing at birth. A lower score in the APGAR means the baby might require more medical assistance. So overall, the outcomes were better in the intended waterbirth group. Another trial that found benefits to waterbirth was a randomized trial that was published in 2015 by Gaiti et al. They randomly assigned 60 participants to waterbirth, 60 participants to land birth, and everyone who was assigned to those groups gave birth in the assigned manner. The researchers did not find any differences in newborn health outcomes between the groups, but they did find several maternal health benefits with waterbirth. Compared to the land birth group, the waterbirth group had a much higher rate of intact perineum, again, meaning their perineum was uncut or untorn. That was 25% versus 8% in the land birth group. They also had a much lower rate of episiotomy, 2% versus 20%, and lower pain scores on average. The total length of labor was also shorter in the waterbirth group by almost an hour. It was 50 minutes shorter, and they did not find any differences in blood loss or other health outcomes between the groups. Now, the problem with the randomized trials on waterbirth is that they tend to be rather small. The largest one had 200 participants total. And so this means that they cannot really tell us if there are differences between waterbirth and land birth with regards to rare negative health outcomes. And in fact, researchers estimate that if you were going to see a difference in rare negative health outcomes between the two groups, you would need at least 2,000 people in a waterbirth trial. And this is going to be really hard to do because very few people are willing to be randomly assigned, like flipping a coin, to have a waterbirth or a land birth. And on the other hand, randomized controlled trials are considered to be the gold standard in medical research. So what are we going to do? You know, people don't want to be in these kinds of randomized trials. In other cases, they may agree to be in the trial, but maybe they have to get out of the tub for a medical reason. So because we are unlikely to ever have these large randomized trials, it's really important for us to look at other types of research evidence about waterbirth. In observational or non-randomized studies, researchers are not trying to control who gives birth in water or on land, but they record where people give birth and they measure their health outcomes. And they can do this with very large numbers, so it gives us more information about health outcomes of waterbirth. And then the researchers can combine these observational studies and combine all that data into a systematic review. And the largest, highest quality, and most important review and meta-analysis was published by Burns et al. In 2022. This review included 36 studies, 25 of which examined waterbirth, and they were looking at hospital and community birth settings from the year 2000 to the year 2021. They had nearly 158,000 participants in this data analysis. There were a lot of findings from this really important review, but you're going to hear the list of following health results when water birth or laboring in water was compared to no water immersion at all. They found that the laboring and or giving birth in water group had less use of Pitocin, less use of opioids for pain management, less use of epidurals, reduced pain levels, higher rates of intact perineum in OBGYN settings, lower rates of episiotomy, lower rates of postpartum hemorrhage, lower rates of maternal infection, and higher rates of maternal satisfaction. And furthermore, they found no significant differences between the water group and the standard care group when they were looking at interventions like cesareans, amniotomy or artificial breaking of the water, need for manual removal of the placenta, shoulder dystocia when the baby's shoulders get stuck, severe perineal tears, APGAR scores, need for newborn resuscitation, transient or temporary breathing problems in the newborn, newborn respiratory distress, newborn death, or breastfeeding initiations. There were no differences between the groups in those outcomes. There was a higher risk of one negative health outcome with water birth, and that is cord avulsion, also known as snapping of the umbilical cord after birth. And I'll talk more about that in a little bit. So that was the largest systematic review on water birth. Now I want to go to the single largest individual study on water birth, and that is an observational study published by Bo Bjerg et al. In 2021. Now, one of the problems with a lot of the observational research up until this 2021 study is that unlike with a randomized trial where you kind of, it's a matter of chance which group you get assigned to. So you end up with two groups that are fairly equal at the beginning of the study. In an observational study, you can't guarantee that the water birth group will look the same at baseline as the land birth group. And that's because maybe the people who choose a water birth are healthier, or maybe the ones who get out of the tub and have a land birth are having more difficult births, or they have more risk factors. So to address this problem, Bo Bjerg et al. Studied 17,530 water births and 17,530 land births, in which they matched each pair, the land birth and the water birth group, on more than 80 factors, such as demographics, obstetric history, health conditions, and more. This process is known as propensity scoring, and it's an evidence-based way to use research to try and get two very equal groups at baseline. Now, they only included births that took place at home or in freestanding birth centers, not hospitals, and they found that the water birth group experienced the following positive outcomes: lower rates of postpartum hemorrhage, fewer postpartum transfers to the hospital, fewer postpartum hospitalizations for the birthing people, a lower rate of severe 3rd or 4th degree perineal tears, fewer newborns needing to be transferred to the hospital, fewer cases of newborn respiratory distress, and fewer newborn hospitalizations. They also found a lower rate of newborn death in the water birth group. There were 0.28 deaths per 1,000 water birth deliveries compared to 0.51 deaths per 1,000 deliveries in the land birth group. The only negative health outcomes they found with water birth were higher rates of postpartum uterine infections, 0.31% versus 0.25%, a higher rate of umbilical cord avulsions or cord snapping, 0.57% versus 0.37%. So I've mentioned the umbilical cord snapping twice now, and so I want to kind of explain what that means. So when the newborn comes out initially, the placenta is still inside the birthing person, which they're attached to by the umbilical cord. And with water birth, sometimes there can be an instinct to quickly grab the baby and bring them out of the water. And if you grab the infant too quick, and if they have an abnormally short cord, it could snap the umbilical cord, in which case the baby could lose blood. So this is why midwives today and doctors who attend water births, many of them are trained in preventing water birth cord avulsion. And how you do that is you bring the baby to the surface gently, you don't yank on the cord, and you also observe the cord to make sure it's long enough for, so that you don't have to stand up out of the water or something. Because most providers who attend water births are trained in how to prevent or treat this cord avulsion, it's unlikely to lead to negative health outcomes for the baby, because what they do is if they see that it happens, they immediately clamp the baby's side of the umbilical cord, and that stops any further blood loss. But umbilical cord avulsion or sapping can occur in a land birth as well. So they found in this study, the largest one to date on this topic, as I said, rates were 0.37% in a land birth, 0.57% in a water birth. They also found no differences between water birth and land birth groups with NICU admissions in the first 6 weeks or in rates of overall newborn infections. So next, I want to talk briefly about qualitative research. This is where you're using in-depth data from interviews or written text to describe experiences or understand meaning or phenomena. And a meta-synthesis is when researchers put multiple qualitative studies together to look for overarching themes. The largest meta-synthesis published so far on water birth was published by Rodrigo et al. In 2023. And in this study, they combined 13 qualitative studies from 8 countries published between the years 2013 and 2019. The researchers found 4 themes that went across all of the studies. The first was that reasons for choosing water birth include personal preferences plus knowing evidence-based information. People were looking for a birth method that would increase relaxation, lower anxiety, decrease pain, increase comfort and well-being, and give them a better chance at an unmedicated birth. They were also interested in a lower chance of perineal tears and a shorter labor, and they believed that the evidence so far shows no increased risk to babies. Second, they found perceived benefits of water immersion. Families believed that it gave them more autonomy and control, a higher chance of unmedicated birth, a method of pain relief that doesn't require medical interventions, an easier transition into parenthood, mobility, buoyancy in the water, peace, relaxation, privacy, avoiding Pitocin, and having a positive childbirth experience. Third, they found that parents perceived barriers of water immersion to include pregnancy or labor complications, a lack of support from family or healthcare workers. And then finally, they found perceived factors that helped families to have a water birth included having tubs available and policies that are clear and consistent at their facility, support from healthcare workers who are trained and supportive of water birth, clear and accurate information about benefits and risks, and a culture of respect for water birth as a valid option. Finally, the last type of evidence we have on water birth comes from case reports. Case reports are published documents about a rare medical event, and they are considered the lowest form of medical evidence. Now, they do have one advantage, and that is that they give us information about rare side effects that we might not otherwise see in a trial. But the main drawback is because they typically only report 1 or 2 events. We cannot use this information to determine how common the side effect is, and most case reports are not peer-reviewed. They're usually just written letters to the editor, and they often lack any detail about what actually happened. In 2020, Vanderlaan and Hall published a systematic review of all the case reports that had been published about water birth up until this point, and they were trying to highlight patterns that could be used to make water birth safer. They found 35 case reports with a total of 48 cases reported of poor newborn health outcomes. 43 of these were events that happened with water birth, 11 of which were minor conditions that resolved quickly. Only 14 of these case reports had been published in the prior 10 years, so most of these articles or cases were a lot older and do not reflect current water birth safety protocols. The cases reported difficulty of the newborn breathing, 24 cases, newborn infection, 18 cases, and cord avulsion, 8 cases. There were 7 newborn deaths reported, 5 due to infection and 2 due to unknown causes. And most case reports did not describe the pregnancies, labors, or any protocols followed during the water immersion. There were 5 patterns that the authors discussed. The first was the importance of preventing exposure to waterborne pathogens or waterborne bacteria that can cause illness. The specific bacteria that could be dangerous in a water birth include Legionella pneumonia and Pseudomonas aeruginosa. These bacteria do not typically affect babies born in a land birth, but 12 cases total around the world have been reported after water births. And so they say in their recommendations that water birth providers should ensure a clean water supply and use strict cleaning protocols and disinfection protocols. The second pattern that they talked about was that water aspiration or accidental breathing in of water is not as common as opponents of water birth claim. There have been 11 case reports that described newborn water aspiration, but 7 of these cases were misdiagnosed and should have been labeled as transient tachypnea of the newborn, or TTN. TTN is a temporary delay in when the baby has trouble clearing out the birth fluids from their lungs. This condition can happen at any birth. It happens in 5.7 out of every 1,000 land birth deliveries at term. Because TTN can happen in any newborn, it makes sense that it would sometimes be seen after a water birth. Out of the 48 case reports that they reviewed, only a single confirmed case of true water aspiration was reported, and in this case, the newborn was dropped in the water after the birth, where the baby remained underwater for an unreported amount of time. The third pattern that they talked about was cord avulsion, which I already mentioned, and how this is a potential risk at any delivery, but it does occur slightly more frequently in water births than land births. There were 8 cases of umbilical cord avulsion that they found in the research, and 7 were identified and managed quickly by immediately clamping the cord, leading to no bad health outcomes. The one case that was not treated quickly did lead to the baby experiencing temporary anemia, but the baby made a full recovery. This case report, where the baby did lose some blood, was published in the year 2000, and ever since then there have been protocols and policies published that really emphasize the importance of providers preventing cord avulsion and treating it quickly if it occurs. They also talked about how it's really important to follow current water birth practice guidelines. They found 8 case reports that suggested that the provider at that birth was not trained in safe water birth practices. Here are some examples of unsafe water birth practices that they found. Permitting a water birth even though there were signs of complications such as thick meconium in the amniotic fluid or a maternal fever. Using hot tubs or home bathtubs, these increase the risk of bacterial growth due to recirculating water in the jets and the plumbing. And keeping the tub filled with water for weeks leading up to the birth. As most people know, when you leave standing water, that's when bacteria grows. So again, they talk about, you want to do things that decrease the risk of bacterial growth in the water. So you want to use fresh, clean water supply, and preferably they talk about the importance of using tubs that do not have the recirculating jets. Also, I've read a lot of these individual case reports as well as reading this overview of them, and most of the authors do not recommend banning water birth. Instead, each case report is used to make recommendations to improve safety and informed consent. So we've gone over all the types of research evidence on water birth. Now I want to share with you my overview of the pros and cons of water birth. There are quite a few pros of water birth. Water birth is protective of normal vaginal birth, can increase the chances of having a faster, less complicated birth. It can lead to shorter labors, less need for Pitocin, and lower rates of giving birth with cesarean or with the help of forceps or vacuum assistance. There's a lot of evidence that water birth can help protect the perineum. Both randomized trials and observational studies have reported that water birth has a higher rate of intact perineum and lower episiotomy rates. The largest single observational study on water birth found that it is associated with a lower rate of severe perineal tears. Water birth has also been consistently shown to decrease pain in labor, both in randomized trials and observational studies. As a result, it also leads to less use of epidurals and less use of opioids for pain relief during labor. I want to make it clear that there's nothing wrong if you want or need an epidural or other pain medications during labor, but some people do wish to avoid these interventions if they can, either for personal reasons or because they want to avoid side effects. And if you have those wishes or desires and you plan a water birth, it can be an effective tool to help you meet your pain management goals. The other positive of water birth is that if you're planning a water birth and it's not effective enough and you need pain medication, you can always switch to a land birth with pain medication to stay comfortable. Water birth is associated with improved health outcomes for people giving birth, including lower rates of postpartum hemorrhage, lower rates of maternal infection, and postpartum hospitalizations. It also results in higher birth satisfaction, and in qualitative research, people have described feeling more in control in the water, and they say that the water creates a natural barrier that helps them feel more safe, private, and secure. Finally, water birth is also associated with positive health outcomes for babies. The largest, highest quality observational study on water birth found that babies born via home water birth were less likely to be transferred to the hospital, less likely to have newborn respiratory distress syndrome, less likely to be hospitalized, and they had a lower mortality rate compared to babies born at home via land birth. In addition, one randomized trial found a lower risk of meconium in the amniotic fluid, as well as better APGAR scores at birth. Now, we don't know exactly why these outcomes seem to be better in the water birth groups. It's possible that water birth could affect newborn health because you're increasing the likelihood of a smoother, less complicated birth that goes faster with fewer interventions. There may also be better outcomes because only the lowest risk babies are born in the water. Typically, when there are signs of potential complications, the birthing person is usually asked to get out of the tub. I've already talked about one of the main cons of water birth, and that is the higher risk of newborn cord avulsion. The largest analysis on this subject found a rate of 4.1 cord avulsions per 1,000 water births versus 1.3 cord avulsions per 1,000 land births. The signs of a cord avulsion can include a dramatic change in the color of the water to a deep red, a snapping sound, a sudden release of cord tension, seeing the cord snap, or signs of the baby going into shock. If the cord does snap, it's really important to immediately clamp the newborn's end of the umbilical cord and assess the baby's health. But researchers do not consider this to be an emergency for a skilled provider because as long as it is recognized and treated immediately, then complications can be avoided. And cord avulsion can be prevented, as I mentioned earlier. In a 5-year study that took place at 8 hospitals published by Sidebottom in 2022, researchers had 3 cases of cord avulsion in the first year of the study. And after those occurred, staff were educated on how to prevent cord avulsions. And in the remaining 4 years of the water birth study, they did not have another case. Overall rates of newborn infection do not differ between water birth and land birth, but there have been reports of rare cases of newborn infection after water birth. So preventing infection is really important through evidence-based guidelines, such as using tubs that are easy to disinfect, filling the tub closer to the time of birth, and regularly testing hospital water supply, hoses, and birthing pools. The largest and highest meta-analysis on water birth did not find any increase in the risk of infections in birthing people with water birth. However, the Bovbjerg single observational study did report a slightly higher rate of uterine infection in the first 6 weeks after water birth, but there was no increase in the risk of hospitalization, which means that these cases were treated with antibiotics successfully at home. There does not seem to be any increase in the risk of transient tachypnea of the newborn with water birth. However, most providers who attend water birth will recommend that a birth take place on land if there are signs that the baby might be more likely to experience complications. These signs may include non-reassuring fetal heart tones, maternal fever, meconium-stained amniotic fluid, suspected fetal growth restriction, or other health risk factors. If a provider trained in water birth asks you to get out of the tub, it's because they believe that a water birth would not be safe in your situation. And this kind of goes to something I haven't talked about yet, and that is the newborn dive reflex. So healthy babies have a dive reflex that prevents them from taking their first breath until they are exposed to the air. So they have sensory nerve endings on their face that can sense the air and the temperature change. So a baby being born underwater must be born fully underwater and not exposed to cooler temperatures or air until after their face is brought to the surface. Once the baby's face is in the air, then the lower body and extremities should rest in the warm water to keep their body warm. So if you stand up mid-birth, the baby's not all the way out yet, and their face is exposed to the air, then you're going to be instructed to not get back down into the water because you don't want to re-immerse the baby's head in the water after it's been exposed. Now, this dive reflex can be overridden if a baby is experiencing distress. This can cause a newborn to prematurely gasp before they surface, and this is the main reason why providers, when they're skilled in water birth, they're watching to make sure there's no signs of complications before proceeding with a water birth. A few more cons of water birth: it cannot be combined with some interventions such as an epidural, a spinal, or injectable opioids for pain management. Some hospitals also do not permit water birth if you are using Pitocin. And although most people find being immersed in a tub of warm water pleasurable, it's possible you may change your mind and get out of the tub. In one study that was a survey study of water birth, a small percentage of participants said that they got cold or overheated, or that the baby got cold, or their contractions went away, or staff were not supportive. So sometimes you might just want to get out of the tub. Speaking of water temperature, it is important that the water temperature be assessed at least every hour because you want to maintain the water temperature between 37 to 38 degrees Celsius or 98.6 to 100.4 degrees Fahrenheit. This helps prevent you and the baby from experiencing hypothermia or hyperthermia. Finally, sometimes people ask us, does water birth affect the newborn's microbiome? And the only study I've found on this so far did not find any differences in the microbiome after water birth compared to land birth, but we need more research on this subject. So now that you know all the evidence, let's look at the professional guidelines briefly before I get to the bottom line. In the past, as I mentioned earlier, the American Academy of Pediatrics, along with the American College of Obstetricians and Gynecologists, have published joint guidelines that denounced water birth and discouraged it. In 2016, they did soften their recommendations a little. They began to talk about the importance of informed consent. But in 2022, the AAP released a new statement by Nolt et al. Called Risk of Infectious Diseases in Newborns Exposed to Alternative Perinatal Practices. In this latest statement, when they talked about water birth, they relied almost exclusively on a meta-analysis published by Edwards et al. In 2023. This meta-analysis only looked at the randomized trials and excluded all observational research on this subject. The AAP also mentioned a few case studies about Pseudomonas and Legionella infection, but they never discussed or cited any of the high-quality observational studies or the largest meta-analyses that I've mentioned in this video. Their opinion was, quote, "Families should be cautioned against water birth during and past the second stage of labor, in the absence of any current evidence to support maternal or neonatal benefit, and with reports of serious and fatal infectious outcomes in infants," end quote. But if you've been with me this whole time in this video, there does seem to be a lot of research evidence that they completely neglected to review, and there do appear to be some benefits and pros associated with water birth, which they just completely ignore in their statement. So it seems to me that they seem to have a bias against water birth, which has primarily been a midwifery-led intervention. And it's also likely that they're going to continue to ignore all of the decades of observational studies that continue to be published on this subject. And so unfortunately, what I've found is that around the world, this statement from the AAP, even though it comes out of the United States, it impacts practice in many countries. And so many hospitals continue to ban water birth because of the AAP. And for many families, the only way they can access water birth is through home birth or a freestanding birth center. There are a few hospitals that support water birth, but they tend to be minority. In contrast to the AAP, the American College of Nurse Midwives, the American Association of Birth Centers, the Royal College of Midwives in the United Kingdom, and the New Zealand College of Midwives have all released statements endorsing Waterbirth as a safe, evidence-based option. So what's the bottom line? Well, new research on Waterbirth continues to emerge. We've had decades and decades of research, but it's an exciting topic, so it continues to be studied. We do see benefits of Waterbirth, including protecting the perineum, decreasing pain, higher satisfaction, and a lower episiotomy rate. Evidence seems to show that Waterbirth can be safe for newborns. The largest and highest quality meta-analysis on this subject found that newborns born via Waterbirth had similar health outcomes to newborns from land births. And then in the single largest study on this topic, they found that the babies in the Waterbirth group had better outcomes than babies born on land. This may be partly because Waterbirth leads or is associated with smoother, less complicated labors and births, and partly because the parents who might experience complications are the ones whose providers encourage them to get out of the tub, leaving the healthiest babies in the Waterbirth group. The main Waterbirth complication for newborns is umbilical cord avulsion, which can happen in about 4 per 1,000 Waterbirths. Based on all of this research evidence that we've talked about today, including randomized trials, large observational studies, and meta-analyses, current evidence suggests that Waterbirth is a safe option for families. If you are having a low-risk pregnancy and birth, if you have a desire for an unmedicated, low-intervention birth, and if you have a support team that is trained and experienced in attending Waterbirths, then evidence supports this birth method. If you are interested in Waterbirth, find out which facilities near you offer this and make sure you understand hospital policy. I have personally witnessed false advertising where a hospital advertises that they have Waterbirth to take advantage of the popularity of this option, but in fact, their policies do not permit it. So if your hospital or your hospital-based provider says they provide Waterbirth, here are a few questions you can ask. How many birthing rooms have tubs? Are all the tubs functioning? What are the chances I can get a room with a tub? Do you require parents to get out of the tub during the pushing phase? Can the baby be born in the water? This helps you narrow down whether they're permitting water immersion during labor only or if they actually support Waterbirth. You can also ask, what training do your staff have in caring for parents during a Waterbirth? What training do you have in managing complications during a Waterbirth? What are some reasons I might be asked to get out of the tub? What is your preference for where I birth the placenta? If I need continuous fetal monitoring, do you have wireless waterproof monitors that can be worn in the tub? And what infection control measures do you have for Waterbirth? If Waterbirth is a high priority for you and your chosen facility does not support Waterbirth, you could consider looking at other birth options in your community, or you could plan to take advantage of water immersion in labor before the pushing phase or using a shower during labor, as these can offer benefits as well. And then I also have a one-page handout you can print out about the evidence on Waterbirth that you can use to educate family and other healthcare professionals. Ultimately, as more families, healthcare workers, and birth workers request that Waterbirth be an option, more facilities will begin to offer evidence-based options like Waterbirth. So thanks for joining me on this journey into the evidence on Waterbirth. Don't forget to go to evidencebasedbirth.com to get all the research we've published on this topic, including all the scientific references and a free one-page handout that you can print off. I hope that you find it helpful, and I hope you enjoyed this video. And if you want more content from us, please like and subscribe. Thanks.